Scaling and root planing, SRP, is a cornerstone of periodontal therapy. However, the microanatomy of the teeth provides many nooks and crannies where bacteria can evade even the most skilled dental professionals due to the limitations of their instruments. For example, the cemento-enamel junction contains tiny, scalloped recesses not visible to the naked eye. These microscopic recesses are smaller than the instruments we use, allowing bacteria to remain and grow. Dentinal tubules can also hide bacteria. These minute canals extend from the pulp to the dentoenamel junction, and when bacteria enter, these canals can become fully colonized. Lastly, certain bacteria, such as the red complex species associated with advanced periodontal disease, can invade and live within individual gingival epithelial cells. These cells are also vulnerable to orange complex bacteria associated with gingivitis and gingival bleeding. When combined with scaling and root planing, ARESTIN may play a vital role in treating periodontal disease by helping to reduce pocket depth and targeting bacteria where instruments can't reach, near the cemento-enamel junction, outside the dentinal tubules, and within the gingival epithelium. ARESTIN minocycline HCl microspheres 1 mg delivers a broad-spectrum antibiotic directly to the site of active infection. ARESTIN starts as a fine powder, making it easy to deposit at the base of periodontal pockets. The microspheres immediately bioadhere, and the minocycline inside is gradually released and diffuses into the surrounding tissues, remaining active in the periodontal pocket for up to 14 days. Over time, the microspheres will completely bioresorb. 3 months after treatment, the addition of ARESTIN to SRP has been shown to significantly reduce pocket depth compared to SRP alone. In the fight against periodontal disease, extend the reach of SRP by adding ARESTIN. Indication: ARESTIN, minocycline HCl microspheres 1 mg, is indicated as an adjunct to scaling and root planing (SRP) procedures for reduction of pocket depth in patients with adult periodontitis. ARESTIN may be used as part of a periodontal maintenance program, which includes good oral hygiene and SRP. Important safety information: ARESTIN is contraindicated in any patient who has a known sensitivity to minocycline or tetracyclines, hypersensitivity reactions, and hypersensitivity syndrome that included but were not limited to anaphylaxis, anaphylactoid reaction, angioneurotic edema, urticaria, rash, eosinophilia, and one or more of the following: hepatitis, pneumonitis, nephritis, myocarditis, and pericarditis may be present. Swelling of the face, pruritus, fever, and lymphadenopathy have been reported with the use of ARESTIN. Some of these reactions were serious. Post-marketing cases of anaphylaxis and serious skin reactions, such as Stevens-Johnson syndrome and erythema multiforme, have been reported with oral minocycline, as well as acute photosensitivity reactions. The use of drugs of the tetracycline class during tooth development may cause permanent discoloration of the teeth, and therefore should not be used in children or in pregnant or nursing women. Tetracyclines, including oral minocycline, have been associated with development of autoimmune syndromes, including a lupus-like syndrome manifested by arthralgia, myalgia, rash, and swelling. Sporadic cases of serum sickness-like reaction have presented shortly after oral minocycline use, manifested by fever, rash, arthralgia, lymphadenopathy, and malaise. In symptomatic patients, diagnostic tests should be performed and ARESTIN treatment discontinued. The use of ARESTIN in an acutely abscessed periodontal pocket or for use in the regeneration of alveolar bone has not been studied. The safety and effectiveness of ARESTIN has not been established in immunocompromised patients or in those with coexistent oral candidiasis. Use with caution if there is a predisposition to oral candidiasis. In clinical trials, the most frequently reported non-dental treatment-emergent adverse events were headache, infection, flu syndrome, and pain.